Hi guys, welcome back to the channel after the weekend. So we have finished with herpes infection, herpes simplex virus infection, the varicella zoster infection. There are more infection, but for we as a maxillofacial surgeon, these two or three lesions which I have discussed was the important one. Now one of the viral infection we'll be discussing today is infectious mononucleosis, which have the features which we are involved into. Okay, let's start. Infectious mononucleosis, clinical presentation and pathogenesis. It is usually seen in teenagers or young adults. Present with a sore throat, fever, malaise, headache, and prominent tender cervical lymphadenopathy. The cervical lymphadenopathy is very prominent in infectious mononucleosis. Other than that, the general features including the sore throat, fever, malaise, headache. Okay. Now, the cervical lymphadenopathy involves both anterior and posterior lymph node chains equally. The pharynx is red with a grey-yellow exudate. So, sore throat will affect the pharynx. This infectious mononucleosis uh, will affect the pharynx as it involves both anterior and posterior lymph node chain. It will involve pharynx also, and the pharynx will appear red with a grey-yellow exudate. There is tonsillar and gingival inflammation. So mostly the neck region is involved. Frequently accompany the pharyngitis, the maculopapular rash. So there will be maculopapular rash and there will be pharyngitis, and there will also a petechial hemorrhage in seen on palatal mucosa. This particular petechial hemorrhage is not most commonly seen, but in some cases we can appreciate petechial hemorrhage. The patient will appear acutely ill with prominent fatigue as a chief complaint. The patient will be anorexic and nauseated. There will be neck stiffness and photophobia. And in some cases, splenomegaly is also there. The chronic fatigue syndrome been suggested to be a form of chronic mononucleosis. So, the chief complaint of prominent fatigue has been termed as the chronic fatigue syndrome, क्योंकि बहुत ज़्यादा fatigue होता है patient को. So this is seen or this has been suggested as to be a form of chronic mononucleosis. मतलब अगर लंबे टाइम तक है तो mononucleosis. Okay. So this infectious mononucleosis is associated with Epstein-Barr virus. So in chronic mononucleosis, there will be elevated Epstein-Barr virus capsid and nuclear antibodies. Okay. Now, the Epstein-Barr virus is a herpes virus that causes infectious mononucleosis. So this is also a herpes virus infection, but it's not herpes simplex virus. It is another kind of herpes virus, which is Epstein-Barr virus. Okay, it is transmitted via saliva by direct contact. Infectious mononucleosis was called as kissing disease, and there is a 5 to 15 days of incubation period. So it is mainly transmitted via saliva. Now coming to the differential diagnosis, exudative pharyngitis with cervical lymphadenitis. मतलब जो भी cases में ये चीज़ होंगी, exudative pharyngitis with cervical lymphadenitis like rubella or other diseases, they are the differential diagnosis for infectious mononucleosis. Okay. Coming to the diagnostic workup, LFT CBC. LFT will show increased AST and ALT enzymes, and CBC will show neutropenia and absolute lymphocytosis. So the main diagnostic thing we have to do is the complete blood count and liver function test, and the liver function will show increased AST and ALT enzyme, and complete blood count will show neutropenia and absolute lymphocytosis. That's all for today. We'll be continuing this in the next class. Till then, like, share, subscribe, and comment. Bye.